objective structured clinical and practical examination, which commonly is known as OSCE or OSPE, was designed to test the clinical competencies while simultaneously improving objectivity and reliability.
We remain limited, we remain concerned with the procedures, the skills related to the procedures, and in their response related to OSCE, we remain focused on whatever the response is providing the student. I have mentioned some examples here. That means this will be simply a procedure-based station, and this will be question or response-based station. For example, one station we will give related to the demonstration of the CPR or conducting delivery in the hospital setting. So that means we are assessing the skills related. Yes, ma'am. So we are assessing the procedures related activities there.
स्टूडेंट्स ऐसे थे जो चाहते थे कि OSCE एंड OSPE जो है वो इंक्लूड हो हमारे प्रैक्टिकल एग्जामिनेशंस में, क्योंकि यहाँ पे साइकोमोटर एक्टिविटीज एज वेल एज कॉग्निटिव एक्टिविटी जो है वो एबिलिटी भी हम चेक कर सकते हैं.
These are our students who are going to participate in the OSCE. And these are the stations as already marked. And after the buzzer, we will
start one activity. I want to see that.
घर में किसी को मदद नहीं है यहाँ पे साइड
Professor Jamsheeda Zaroo, Principal, Ramzaan College of Nursing, and present organized by me, Rimsha Rashid, and with the help of Mr. Neeraj Nawaz and Mr. Mudasir Maqool. Starting with the introduction. Providing fair and reasonable clinical evaluation is one of the most important and most challenging faculty roles, as all of us know that. Objective structured clinical and practical examination, which commonly is known as OSCE or OSPE, was designed to test the clinical competencies while simultaneously improving objectivity and reliability. Objective. It is known as objective because examiners use a checklist for evaluating the trainees. It is known as structure because trainees see the same problem and perform the same task in the same time frame. That is why it is structured, because it is already structured and they see the same problem and perform the same task and within the same time frame. Clinical. The tasks are the representatives of those faced in the real clinical situation. That is why it is known as objective structured clinical examination. So we have broken it into these different objective structured clinical examination. Now the definition. Objective structured clinical examination is a method of clinical practical examination where predetermined decisions are made on the competencies to be tested with the use of checklist incorporated in important skills. We already have a checklist with us of the procedure which is to be performed, and then predetermined decisions are to be made about the skills which are to be checked in the student or the exam or the whoever is to be evaluated. The candidate rotates through a number of stations at which they are asked to carry out a specific task. The candidates are to be rotated within the stations where they are asked to perform the different tasks. Background of OSCE. Considering the drawbacks of TPE, teaching performance expectations, because in the older जो हमारा पुराना मेथड होता था वहाँ पे हमें ऑलरेडी एक्सपेक्टेशंस होती थी फ्रॉम द स्टूडेंट्स, तो उसमें क्या होता था, उसमें बायस होता था विद द स्टूडेंट्स. तो जो हमारा ये नया मेथड होता है इसमें कोई भी बायस नहीं होता है, बिकॉज जब हमारे पास स्टूडेंट्स आते हैं तो वी हैव द एक्सपेक्टेशंस फ्रॉम द स्टूडेंट्स. तो हम क्या करते हैं, हम किसी में कोई ज़्यादा मार्क्स, किसी में कोई कम, बट यहाँ पे कोई बायस नहीं होता बिकॉज वी ऑलरेडी हैव अ चेकलिस्ट इन फ्रंट ऑफ अस एंड हमें पता होता है इसने ये किया वी टिक मार्क दैट, इसने ये किया वी टिक मार्क दैट. बट जो हमारा ट्रेडिशनल ये प्रैक्टिस एक्सपेक्टेशंस होता है वहाँ पे क्या होता है, कोई ना कोई बायसनेस हो जाता है. ठीक है. OSPE started in 1972 in Dundee, Scotland by R. Hardin and F. Gleason. First introduced in medicine. It is used in undergraduate as well as postgraduate program, both formative as well as summative evaluation, and now used
एक मिनट
Yes, ma'am. Then we have purposes of OSPE. To test each component of clinical competence uniformly and objectively for all students. To assess the extent of achievement of each student in every practical skill. To improve the objectivity and reliability of clinical evaluation. To evaluate set of predetermined clinical competencies and to reduce patient examiner variability, as explained already. Difference between OSCE and OSPE. It is the common confusion. We get confused between OSCE and OSPE. Domain. In OSPE, we have higher level of knowledge, and in OSCE, we have psychomotor only. Testability. In OSPE, it identifies structures on image, specimens, radiographs and relates it with clinical scenario. In OSCE, it applies the structural knowledge to perform examination and procedures. Time given in OSCE is 2 to 4 minutes per station. In OSCE, it is greater than 4 minutes per station. Space. In OSPE, it is one big hall. In OSCE, it is isolated small classroom close to each other. Examiner. In OSPE, non-specific 2 to 3 persons per hall. In OSCE, expert examiner for watch station. Checklist. Not required in OSPE, OSCE required. Centralized patient. Not required in OSPE, in OSCE it is required. Observers. Not required in OSPE and in OSCE it is required.
there is this confusion. OSPE is usually practicing in the college, in classroom and lab, and OSCE in clinical area because it is psychomotor. But if they are isolated small classrooms close to each other, is it relevant here?
मैम एक्चुअली there is जो difference आप कह रहे हैं मैम, I went through different books. Ma'am, actually they have mentioned that this OSCE, that is clinical examination, in this we check clinical skills. It is not related to, ma'am, we can do it in the hospital setting as well, but it is related to the clinical. That's why the domain there is psychomotor domain.
That is what I am telling you. Psychomotor activity is utilized in the lab.
Yes,
or
ma'am.
hospital.
It can be used in the lab or in the hospital. Yes,
Not
ma'am.
in class.
Which ma'am? No, not in class. Not in class.
But you have mentioned here class.
Ma'am, no, ma'am. This is the place where you can create the OSCE like environment. It is not like that we can do it in the different stages, ma'am.
जैसे CPR अगर देना है तो हम एक क्लास में वो चीजें arrange कर सकते हैं।
Different stations, ma'am.
मैम ये स्टेशन बनाने के लिए छोटे
जो ये दोनों चीजें, जैसे हमारा CPR है, चाहे OSCE है, लेकिन मेनली जो हमारा एक है सिमुलेटेड टीचिंग. सिमुलेटेड टीचिंग इज ऑलवेज डन इन द लैब. अब हम क्या करते हैं, अपनी कन्वीनियंस या कुछ हमारी लैंग्वेज या डेफिशिएंसीज होती हैं, हम क्लास में ही ले जाते हैं इंस्ट्रूमेंट और वहाँ ही दिखाते हैं बच्चे को. लेकिन मेनली जो हमारा OSCE है, ये हमें लैब एंड क्लिनिकल है, ठीक है, बिकॉज साइकोमोटर एक्टिविटी व्हाटएवर इज यूटिलाइज्ड, इसमें हमारा एफर्ट चाहिए. हमारे 10 बच्चे क्लास में हैं, 10 के 10 का हम एफर्ट नहीं देखेंगे. हम 10 स्टेशंस बनाएंगे, 10 स्टेशन इट इज आल्सो हम डिस्कशन करेंगे, इससे हमारा डाउट क्लियर होता है ना. 10 के 10 का जो हमें उस वक्त साइकोमोटर एफर्ट, हम उधर हम क्या करेंगे, कॉग्निटिव डोमेन क्लास में चेक करेंगे, है ना, यहाँ उनका एफेक्टिव डोमेन. लेकिन साइकोमोटर प्योरली लैब एंड हॉस्पिटल, है ना. मेरे को भी क्लियर हुआ, आपको भी हुआ. अगर कहीं क्या का इसमें
कंफ्यूजन था मैम. इसमें एक बहुत बड़ा कंफ्यूजन है मैम. OSCE एंड OSPE में क्या डिफरेंस?
अब देखो क्या है,
लेकिन OSCE में मैम यहाँ बोला जाता है कि OSCE में प्रैक्टिकल, OSCE में हम जनरल को देखते हैं, जैसे उसमें हिस्ट्री टीचिंग, असेसमेंट, हिस्ट्री टीचिंग,
highest level of knowledge. Go on, you are using using the cognitive.
Cognitive, yes,
Ma'am, this point has been mentioned only because of the space, ma'am. हम space कहाँ पे हम utilize कर सकते हैं?
जी,
तो आगे भी हमने रखा है।
जी।
आपको मैं बिल्कुल सही कह रहा हूँ, बिल्कुल सही
ना,
कह रहे हैं।
I may be wrong also, लेकिन जो मुझे लगा कि यहाँ पे हमें mainly lab and हम क्लास में तभी करते हैं
क्लासरूम रूम्स को
पर्टिकुलर
या फिर भी हॉस्पिटल में
पर्टिकुलर
होता है एडमिनिस्ट्रेशन
मैंने कई बार क्लासरूम में सिर्फ अपना साइकोमोटर ये किया क्योंकि मैंने बच्चों को लिखा है मगर इसका I couldn't take because it is examination. It's not just doing. I am doing okay. They are watching me, but what they are doing, I am assessing them. I have a checklist. Whole class को मैं एक साथ नहीं कर सकती हूँ checklist.
तो जैसे हमारे प्रैक्टिकल एग्जाम्स हॉस्पिटल में होते तो वहाँ पे हम रखते हैं ना अलग अलग सिचुएशंस वहाँ पे भी
The steps in designing and implementing an OSCE and OSPE have a set of clear objectives, identify the practical aspects, then we have to select the task, we break the tasks into subtasks, assign the scores for each task, then set up the stations, conduct after orienting students and examiners, make notes of the process and reviews, analyze the results and use the same for students and assessments.
Okay, यहाँ पे ये चीज़ कहना है कि अगर हमें दूरी बात है अगर हमें बच्चे को एक सिचुएशन देनी है फॉर एग्जांपल कैरेक्टराइजेशन हो गए एक स्टेशन उसमें हमें टाइम फ्रेम है 4 मिनट्स
डिपेंडिंग ऑन द टास्क।
तो हमारा एक्शन वही कंप्लीट हुआ ये मुझे खुद कंफ्यूजन है मेरा हो गया तो देन ही हैज टू गो स्टेशन 2 इज इट पॉसिबल ही विल मूव टू सेकंड स्टेशन क्योंकि हमारे पास पर डे 20 स्टूडेंट होते हैं एग्जामिनेशन के लिए तो हमें एक बच्चे के साथ 5 to 10 मिनट्स एक प्रोसीजर के साथ देने हैं गो 1 आवर हमें एक बच्चे के साथ लगेगा 10 बच्चों के साथ क्या लगेगा दिस इज सॉर्ट ऑफ वर्कशॉप एंड सेमिनार इसमें हम कैसे बनाएंगे कि हमें बच्चे को वी आर नॉट सपोज टू मूव फ्रॉम वन टू अनदर सेम बच्चे को दैट मीन्स हमें 10 बच्चों को 10 प्रोसीजर देने हैं 10 एरियाज चेकलिस्ट लेके फाइनलाइज करना है राइट ऐसे कर सकते हैं सोच के बताओ
मैम आई थिंक हम इसमें एक प्रोसीजर करते हैं उसमें वो डिवाइड करते हैं लाइक अभी जो प्रोसीजर है मैम लाइक कैटेगराइजेशन उसमें मैम एस्पेक्ट्स हम सब टास्क्स रखेंगे एक
task break the task then assign the school
जी जी मैम
then set up the station then conduct of the अच्छा make notes of the process अच्छा एक एक्टिविटी को
लाइक एक टास्क हमने लिया कैटेगराइजेशन उसमें मैम हम फिर सब टास्क रखेंगे हिस्ट्री वाला पोर्शन की बच्चे ने ये वाला क्वेश्चन किया बच्चे ने इंट्रोड्यूस किया खुद को बच्चे ने ग्रीट किया बच्चे ने पूरा प्रोसीजर किया है पहला ये वाला एस्पेक्ट हम देखते हैं देन दूसरे में प्रोसीजर वाला प्रोसीजर स्टेप तीसरा आर्टिकल्स के रिलेटेड आर्टिकल्स से कनेक्टेड और पोस्ट प्रोसीजर
as it is indicated here we break it into subtasks then we go to the
नेक्स्ट के मॉडल्स आते हैं डिफरेंट एक्चुअली हम इसको मॉडल्स बेस हम प्रोसीजर्स डिफरेंट भी रख सकते हैं और एक प्रोसीजर को डिवाइड कर सकते हैं सब टास्क में
हमारे लिए
इट इज अप टू अस
हमारे
जो
लिए
है
इजी रहेगा वन स्टेशन पे जैसे मैं स्किल्स में करती हूँ वहाँ जाकर मैं क्या करती हूँ उनके पास एक डिग्री है नर्सिंग फाउंडेशन लैब में उनको 4 बेड टोटल 4 बेड गवर्नमेंट का है तो अब 4 बेड पे लगाती है बेचारी वहाँ की टीचर 4 स्टेशन लेकिन काम हम एक ही पे करते हैं
नहीं मैम
वहाँ मेरी बहन बोलती हूँ वहाँ बेसिक है ये ग्राउंड लेवल पर का समझ लेकिन मैं मेरे का हमारे कॉलेज में तो कम से कम 6-7 बेड
पर्पस ही इसका
मत वापस
हमें रिसेंटली OSCE हुआ था मैम उसमें डिफरेंट प्रोसीजर्स थे और डिफरेंट डेट्स
अच्छा
फॉर एग्जांपल एक सिंपल सा ये भी रखा जाता है कभी आइडेंटिफाई द इंस्ट्रूमेंट
हाँ,
समटाइम्स है समटाइम्स डिपेंड्स अपॉन
इसका मेन मकसद यही होता है कि हम देखें कि
जो
जो
mutual
स्टूडेंट
input
है हाँ वो कितना
मेडिकल कॉलेज में होता था वो होता था लैब स्टूडेंट्स के लिए मेन पैथोलॉजी में माइक्रोबायोलॉजी में उनको इंस्ट्रूमेंट रख के या स्पेसिमेन आइडेंटिफाई द cell.
Yes, ma'am.
Yeah, identical instrument tells the 5 functions, 2 functions of this instrument, uses of that. वो टाइप का होता था जब हम वहाँ पढ़ते थे. अब इसमें मॉडिफिकेशन है ना. अब नर्सरी में ये हो गया इंट्रोड्यूस.
मैं जैसे वो है ना मैं समझ कर कि नहीं
हमने
पायरामिड हमारे टाइम पे तो
हमने वैसे ही
आइडेंटिफाई करना था ये क्या है वो बना के वो ट्रेन उस पे लिखा था ऐसा हम गए वहाँ उस स्टेशन वहाँ देखा था कि आइडेंटिफाई करो वहाँ आंसर में वही नेशनल वगैरह की नहीं है वो लेकिन इसमें ट्रांसलेशन में ये
हाँ सेम टाइम
जैसे मैं एक में ये नहीं कर सकता कि एक में
नहीं टाइम सेम होना चाहिए
टाइम पे
हाँ
सेम.
किसी स्टेशन पे सेम
सपोज मैं स्टूडेंट हूँ, पहले आपने मुझे ऑब्जेक्टिव्स आते थे, फिर आपका फिर आपने सिलेक्ट मुझे दिया, टास्क दिया, फिर उसको आपने ग्रेड किया, है ना. फिर आपने फिर क्या किया आपने
हम स्कोर किया उस टाइम
मतलब
प्री में कितना आया ड्यूरिंग प्रोसीजर है पोस्ट प्रोसीजर
नो मैम बिफोर जब जितने भी हमने सबस्टेशन वगैरह ये हम सब टास्क किए उसके हर एक टास्क को हम अपने वेटेज दे देंगे. फिर एट एंड हम देखेंगे कि किस बच्चे ने कितना स्कोर किया हुआ है. उससे हमें पता चलेगा मैम कि ये बच्चा इससे कितना स्कोर किया हुआ है.
चेकलिस्ट तभी होता है.
Yes, ma'am.
चेकलिस्ट इज मस्ट एंट्रीज. ओके.
किसी को सब मिक्स ये हम मिक्स होता है
This is all from my side. Thank you so much.
Assalamualaikum, dear faculty. My name is Neeraj Nawaz, and I will be continuing with the OSCE and OSPE. Thank you, Rimsha, for the first part. Thank you. So now moving ahead to the types of the OSCE that you have. We have categorized the types of the OSCE and OSPE into various categories. Now, for example, in the first type, we will see whether the examinee is interacting with their patient or not, or with any simulated patient or not, and that type we call as the interactive OSCE or OSPE, in which in the simple words if I will put it, it simply means whenever the examinee or the any student is interacting with a real student or any simulated student, their interaction is happening there between the patient and the student. So that type is called as the interactive OSCE, OSPE. And in the non-interactive, I would like to clear here one confusion, that in the non-interactive there is no need to keep the dummy there is no need to keep the simulated patient there is no need to keep the real patient there. Sometimes we can keep a simple question on the in one station, that calculation the fluid requirement for this patient based on the condition. At that time we would need to interact there. So that type of OSCE or OSPE we call as the non-interactive.
Students written response.
Yes, we get the written response there. Further, you will see that we have categorized it into purpose, procedure, and response. I will clear that thing in the future. So now here, the second type of the OSCE or the OSPE is the manual and the unmanual, and it means whenever there is presence of the examiner there, sometimes based on the model or the type of the OSCE that we are opting here, we can keep the examiners there who will assess the students based on the checklist, or sometimes we can leave the station unmanned. That means there will be the absence of the examiner, and we will after that see the response that he has written on the question paper. Yes, these were the two categories of the classification of the OSCE and OSPE. Now after that, the another type is that based on the procedure and based on the response there. That means this type of OSCE or OSPE, in this we remain limited, we remain concerned with the procedures, the signals related to the procedures, and in the response related to OSCE or OSPE, we remain focused on whatever the response is providing the student. I have mentioned some examples here. That means this will be simply a procedure based station, and this will be question or response based station. For example, one station we will keep related to the demonstration of the CPR or conducting delivery in the hospital setting. So that means we are assessing the skills related. Yes, ma'am. So we are assessing the procedures related activities there. But in the response, if you will see at the example here, you will see that we will keep a question related to the drug calculation. So that means at that time the student or the examiner has to calculate the drug that will be needed to administer to the patient or the simulated patient there, whatever, and interpretation of lab reports. So it is based on the knowledge there. It is not based on the procedure there. We can keep procedure based and we can keep the response based as well. After that, moving to the key components of the OSCE, which are here. The first one is that there is a time limit for each station. So each station should have a time limit, and usually we do that, we familiarly maintain the time. For example, 2 minutes for each station based on the structure जो हमने already वहाँ पे किया होगा in the planning process. 5 to 10 minutes is the provided guidelines for the OSCE and OSPE. After that, the examiner or the observer that will be present here will have a checklist at the each station to carry out the assessment, which जो कि already हमने पहले ही structure बनाया होगा checklist. Based on that, उसको evaluate करेगा. And after that, all the students are assessed according to the same standards. So यहाँ पे ये चीज mention करने की जरूरत है कि we are nursing college here कि sometimes the biasness happens in different types of procedures there. So ये चीज इसमें this becomes an advantage of the OSCE OSPE that हम क्या करते हैं, हम सारे स्टूडेंट्स को एक सेम स्टैंडर्ड में असेस करते हैं, तो वहाँ पे वो biasness हम रिमूव करते हैं कहीं ना कहीं पे. And after that, students may communicate with this standardized patients via role playing. जो मैं आगे चल के आपको बताऊंगा कि इसमें हमारे पास टाइप्स होते हैं. We have real patients, we have standardized or simulated patients we can utilize for the OSCE or OSPE. And if they are communicating there, we can do that by the role playing as well. We can take any faculty member, tell him to play the role of a patient there. We can take another student there who will play the role of, if we don't have the availability of the patients there. So after that, moving to the patients in the OSCE, the patients that we use in the OSCE, we use real, it is actually real stable patients there. Cause critical and unstable patients we never use for the OSCE there. Yes, we use the real stable patients, or we can use the stimulated or standardized patients there. And moving to the real stable patients there, that is the RSP there. Clinically stable patients can be used there, which are clinically stable as standardized patients, and ideally a physician will observe the scenario there before the examination whether that patient is stable for OSCE or not. That is the responsibility of we have to contact the physician there to get the approval for that patient, because sometimes negligence or malpractice can happen there and it can become a legal case there. And after that, moving to the simulated and the standardized patients, those patients or the persons which are playing the role of the patient here, that is the simulated patients, can be used instead of the actual patients here. Moving to another segment of the topic, that is the instructors, lay persons or the students can be prepared for the role of the standardized patients there. Already discussed that we can use students there, we can use the now lay persons there. In some of the literatures it has mentioned that you can choose the volunteers or you can get the paid persons for this purpose to act as the simulated or the standardized patients. Then after that, the training of the standardized patient must stress the following. The first thing, inform them the purpose of the training and their role. We have to inform them clearly before the OSCE or the OSPE what their role will be there, and the direction should use patient based language. जो भी वहाँ पे standardized patients होंगे तो उनको क्या करना है, उनको patient based language जो है वो वहाँ पे use करनी है वहाँ पे for the OSCE or the OSPE. Specify patients' perception of the problems. Now, when it comes to the standardized patients, हमें उनको बताना है कि what is the perception of the patient here in case of simulated or the standardized patients there. So after that, provide only relevant information. Now, in case of the standardized or the simulated patients, we have to provide them only the relevant information. Because what can happen here is that biases can get created there if we give them more information which will not be relevant. So whenever there will be 10 students who want to be evaluated, maybe to one patient, maybe to one student or the examinee, he will give one information to another, different sort of information, and at that time scoring can be biased here. After that, moving to the response to all the checklist items should be included. And lastly, the guidelines for conducting the examination. Describe patient's behavior and affect there. Describe symptoms to be stimulated there. Provide training on signs to be stimulated there. Because this Cause this simulated person there or simulated patient there has to copy the characteristics or has to act the role of the patient there in the hospital or in the OSCE setting. Now after that, moving to the, here is a simulated patient here, and it is the procedure of the history taking. One example of that, another simulated patient. This actually here is either a student or a hospital employee there acting as the simulated patient in the examination. Now after that, moving to the methodology for the OSCE or the OSPE there. Now firstly talking about the stations there. In the stations, the students during the examination moves around a number of stations there, spending a specific amount of time in each station. On the signal, it can be a buzzer, it can be a bell. On the signal, she moves to the next station there, and the time allowed is the same for all the stations there in order to prevent that chaos there. And the stations must be designed accordingly. 3 to 10 minutes are given in each station depending on the importance of the procedure here or the importance of the clinical skills there. Now here is a diagrammatic representation of the OSPE station here, and you are seeing that here total 12 stations have been created. And for example, when firstly we will distribute the students into 1, 2, 3, 4, 5, 6, and we will fill all the stations there. Then after that, on the buzzer and after finishing of the time, we will move on the buzzer this student will move to here, this student will move to here, this student will move to here. The question here is that where will that 12th student go? That student will move to the station number 1 until he will not complete all the stations there. He will not get circulated in all the stations there. When he will complete all the stations there, then after that he can leave that area, that OSCE or OSCE area there. Now
this indicates that 12 students are there. All the 12 students are having one procedure.
Oh yes, ma'am.
One procedure. We have one checklist. We have fixed time for each student.
Yes, ma'am.
Once the one will move from one to second has immediately.
Yeah,
It's
exactly.
not suppose that third will delay
No.
and there will be wastage of time. That is one activity within one framework, one time, and only one procedure.
Yes, ma'am. It should be connected with
Not
strict discipline.
12 procedures.
Yes, ma'am.
It will be only one.
I'm saying sometimes there may be 12 procedures.
Ma'am, actually what happens?
That is, listen, if there are 12 procedures, you will give them limited time.
Yes, ma'am.
One student will finish one activity within that framework
Yes, ma'am.
and he will move.
Ma'am, I will give the diagrammatic representation of the procedures that we give, for example, say. So now moving to the where we can conduct the OSPE or the OSCE, which already we have mentioned that any area where there is a space available and resources available, we can conduct it. The confusion where that classroom can be used or not, depending on the resources whether we have available or not. So clinical setup, OBD we can use, other hospital settings we can use, multi-purpose hall we can use there, examination hall we can use there for the OSCE, OSPE, library we can use there, laboratory and nursing foundation lab there we can use, and a large classroom etc. can be used depending on whether we have resources available or not. But it is better always to conduct the OSCE or OSPE either in the hospital settings or in the clinical lab because we have the
Ideally that will be.
yes ma'am, हमने पहले खुद वही सोचा था कि हम क्लास में करेंगे उसको, but then after that yes ma'am, but after that हमने किया कि हमने कहा कि it is better कि हम वहाँ पे करें इसको. So after that, now here is again the diagrammatic representation of the OSCE station map here. So the students will start or we will distribute them. Now it depends on the methodology here. So it can create confusion as well. We can distribute all the students. For example, these are 6 stations here. We can distribute the 6 students in 6 stations. Or we can do another thing. We can start a line here, and one student will go here. They will wait. But depends on. But better is that one. So that
indicates here it is.
yes, ma'am. For example, station
And
1.
this is station.
Ma'am, we
Second
have
part of
newborn resuscitation. One procedure, second one will be related to power.
Then
Third procedure will be related to family planning counseling. And the fourth procedure one will be I forgot it is full form.
ENPC.
Yes, ma'am.
ENPC. Okay, it is actually baby care something. Newborn.
Essential newborn care. Essential newborn care. Yes, ma'am. So after that we can station. Yes, ma'am. After the antenatal camps we use for the antenatal counseling or for the antenatal care that we do. And after that, the station 6 is related to the active management of the third stage of labor here. And after that, when all the students will complete this day, then only they can leave. So here the main confusion जो मैंने अभी देखा कि यहाँ पे हुआ कि क्या हम एक प्रोसीजर वहाँ पे रख सकते हैं, क्या स्टूडेंट को एक ही प्रोसीजर करना पड़ता है, बहुत सारे प्रोसीजर्स करने पड़ते हैं. It depends again. Depends means अगर हमने एक प्रोसीजर को डिफरेंट सेगमेंट्स में डिवाइड किया है तो एक ही प्रोसीजर है.
नवाज, आप सही बोल रहे हो, कंफ्यूजन कहीं नहीं है. It's well defined that we can either split one procedure
Yes,
in
ma'am.
6 areas,
Or we
or
can
we can give 6 procedures
Yes,
for 6 students. In case of splitting the procedure in 6 areas, student has to go from one to another to another. But in case of giving only one procedure, she will finish in station 1 and she will go.
Yes, ma'am.
In both cases, we have a checklist whether she has completed all those activities, required activities. है ना? Actually, कोई करता
हाँ, नहीं यहाँ पे मैम मुझे एक चीज कन्वे करनी है कि इससे हम क्या कर सकते हैं, 1 2 3 4 5 6 6 प्रोसीजर्स 10 प्रोसीजर्स भी हम एक्सेस कर सकते हैं,
एकदम कर सकते हैं.
एक साथ प्रोसेस कर सकते हैं.
But there is one, this, there is one constraint. 6 teachers are required.
यस मैम, वो इसका ड्रॉबैक है कि हमें वहाँ पे यूटिलाइज करना पड़ता है, दैट इज द ड्रॉबैक. So ma'am, here is a pictorial representation of the, for example, station 1 here, station 2 here, station 3, station 4, station 5 here. Now it is preferred that we do the OSCE or the OSPE in the cabins. Because at that time, this student will not disturb this student, this student will not disturb this student, and it will be their
Copying नहीं होगी, helping नहीं होगी.
exactly ma'am. So here is a representation of the OSCE OSPE examination here. And in the foreign countries, this method is actually preferred compared to other procedures.
Yes.
So after that, what is assessed by the OSCE or the OSPE there? We can assess various clinical skills there. We can assess the knowledge related to the history taken or the skills related to it. We can assess the physical examination skills of the students there. We can assess the technical procedures that are done in the hospital. We can assess the knowledge related to how they take things. Anything, verbal interpretation, communication, interpersonal skills. For example, in the interpersonal skills, if an examiner is present here, we will see how the patient is behaving with the patient here, how the student is behaving with the patient. Yes, ma'am. How behaves with that attitude? What is the attitude of the student or the examiner with the simulated patient or the patient here? After that, in the advanced planning, what we have to do is that we have to first see the blueprint of the, we have to frame actually the blueprint of the OSCE station here, how we will conduct it. The patients have to be selected at brief if they are real patients, and after that, the examiners and the staff concerned to be briefer, they are to be briefer. जो भी इसमें examiners and staff concerned होगा उनको brief करना है पहले how we will conduct it, and after that the venue for the conduction of the examination वो भी हमें already उनको inform करना है और हमारे पास structure पहले से होना चाहिए. Checklist, on the basis of the checklist, actually this according to me this is a very good advantage of this, that teacher's biases will not happen there. There will be already a checklist and it will be same for all the students there. After that, the instructions to the candidates, evaluators and simulated patients, we have to provide them with the instructions there. Moving ahead, again with the OSCE, after that, the duration of the station, as already mentioned, it should be 3 to 10 minutes. Number of stations, again, there should be no question related to it, that it depends on the number of the students and the tasks to be performed and content to be covered. It depends on us.
और एक चीज पे ना नंबर ऑफ स्टेशंस और एक चीज पे डिपेंड करता है कि हमारे पास स्पेस
Yes.
हर स्टूडेंट एक्शन हाथ के नहीं वो डिपेंड करता है स्पेस.
So after that, the number of the examiners, it again depends on the need and the availability. We already said that the examiners arrange the examiners there. For example, in the internal arrangement, we can do the OSCE. But sometimes in the external examination, it will not be possible to.
Now our exam will come. She herself said, I will do the OSCE. If she individually conducted the exam, it will take 5 to 10 days. Has to conduct the OSCE for 88 students or 60 students. So internally we can do those what we are
Internally?
doing. We can do.
So after that, moving to the use of bells, we can do buzzers, we can do in order to change the signal. And the resources are required for this OSCE, OSPE, their tables, bells, etc. Assigning the priorities to include must know the categories of the procedures that we are keeping in this OSCE and OSPE. Arrangement for the examiners and other supporting staff and simulated patients. So we have to also do the arrangement for them as well. And the directional arrows. The directional arrows, for example, where do they have to move from this table to this table? But we can do that. We can inform them or we can instruct the students prior to the conduction of this that this will be the. But it is better if we will keep the arrows there. Then where do they have to go? After that, the marking scheme that should be in the OSCE, OSPE. Marks allotted to each item on the checklist. We have to already. It is a structured thing. So we will in advance we will allot the marks for the checklist.
जैसे हमारे चेकलिस्ट होते हैं रेटिंग स्केल है चेक वही है ना रेटिंग
Yes,
स्केल
ma'am.
उसमें 5 उसमें 4 उसमें 3
2
Yeah, 1 and 0. If the students have done that particular task, we can mark 1. If not, then
zero.
Actually, it depends. The marks are allotted for each stations depending on the importance of the task here. For example, if it is a simply identify the instrument, we can keep certain number of marks for that. And if it is an important procedure, critical procedure, we can keep more marks for that.
कहीं हम ऐसा करते हैं चेकलिस्ट में यस नो यस या चलिए से यस नो क्योंकि यहाँ पे हमारे मार्क्स अलॉटेड है ना रेटिंग्स है.
So after that, we have to provide the instructions. As already discussed, we have to provide the instructions to the students, to the patients, there, and the examiners there as well. This instructions for the students there. What sort of instructions we have to provide to the students? Firstly, we have to display the roll number prominently. वहाँ पे जो भी उनका checklist होगा या जो भी उनका answer sheet होगा वहाँ पे number of stations and we have to mention here this is the station. Proceed in one direction. Time allotted. Start and end of the time there. Clear instructions are to be given at each station. After that, no interaction with the examiners there. The examiner and the examiner should not do any interaction here. No negative marking is done here. After that, the patients, we have to inform them about their rules, uniformity in their answering, and not to give any extra information we will not give to them. After that, the OSCE station requirements, the task. Most importantly, जो हम उनको टास्क दे रहे हैं, that should be there instructions for students available at the station. Those should be pasted there outside the station there. What are the instructions for them? जो कि हम मैम आप लोगों को आगे भी दिखाएंगे कि जो उनका प्रोसीजर होगा उसके रिलेटेड उनको क्या करना होगा. After that, the instructions for standardized patients already discussed. Assessment tool, checklist that should be present there. Guidelines for conducting the examination. Resource needed already discussed there. Uniform station time limit should be there. Mannequins and the articles to set up the station as guided by the examiner there. And after that, there should be a superintendent or the examination coordinator there who will conduct or coordinate all these processes there. Now, what do we have to do before the OSCE examination? We have to discuss the number of the OSCE stations, time limit for each station there. We have to discuss the OSCE round with the students there, and we have to collectively decide it and frame it. After that, now what do we have to do as an examiner or as a student? What do we have to do during the OSCE? We have to observe and assess the students' performance. If an examiner is present there, stand where you can see without intruding and let the student perform the cycles. So that means normally what we do, ऐसा करो, we don't have to do that. We have to leave it to the student there. Whatever he will do, we have to observe that and score on that basis only. We don't have to interfere with the process there that is happening between the simulated patient and the student there. Must be discussed with the student following the OSCE. Now, important point there that after conducting the OSCE, we have to discuss it with the student how it went, etc. We have to take the feedback there. Feedback must be delayed until the completion of all the stations or in the OSCE. Now, after the end of the OSCE there, we have to review the performance of the students there. We have to provide positive feedback and offer suggestions for the improvement there. We have to determine if the student is complete or needs additional practice in each station. We will see that on the basis of the scoring system, which I can show you here, that this is the overall scoring system of the OSCE and the OSPE here. And on the basis of this scoring system, we can identify where our lacunas are, where our weaknesses are. We will see that in the score list also, that for example, this is the number of the students there, 1, 2, 3, 4, and this is their total score. They have scored 21, they have scored 18. So that means this is the performance of the students they have done. But here we can assess in the station 1, for example, it is related to the active management of the third stage of labor. If among all the procedures there, 1 procedure, 2 procedure, 3, 4, 5 procedures, we will get a least number of score in any station. So that means in that procedure there is lacunas or there is weakness. We have to improve there. We have to.
So we can improve that.
Yes, ma'am. This is again the format for the overall scoring completion sheet that we do. After that, the model in the nursing, model station in the nursing. So, example sake, we have mentioned it here that in the fundamental of nursing lab, we can do the OSCE on rare procedures like death care. We can do the procedure, we can keep the procedure on CPR there. We can keep the procedure on bowel wash, bladder irrigation. After that, OSCE in medical surgical nursing, if we will see, tracheostomy care we can keep there, colostomy care we can keep there, blood transfusion, setting up for the surgeries we can keep there, and interpretation of ECG or EBG. This is just an example of the different procedures that we can keep in the OSCE or the OSPE. Now OSCE in the maternity nursing, instrument names and procedures we can keep in one station. We can keep management of PPH there. We can keep management of eclampsia there. We can keep IUCD insertion there, and we can keep the episiotomy suturing there. Just examples there. So after that, the OSCE in the child health nursing, immunization procedures we can keep in the OSCE station. Use of restraints in children we can keep in the OSCE station. Neonatal substation, we can keep feeding neonate with cleft lip or cleft palate. There's a wide range of procedures that you can keep in this OSCE and the OSPE. Now moving ahead to the OSCE in community health nursing, ORS preparation we can keep in one station. We can keep the dietary advice to antenatal mothers for this mediate the simulated or the sterilized patients or the real patients there. Checking temperature of the child we can keep, and wound dressing we can also keep in this. After that, moving to the OSCE in psychiatric nursing, counseling alcoholic clients, managing patients with extrapyramidal side effects, assessing memory status of the patient, we can keep orienting the patient after the ECT.
Mental status, mini mental
status. So after that, moving to the now the advantages of this OSCE or the OSPE there. It becomes a valid examination as already discussed. Objectivity and reliability are increased there. The examiners can control the complexities of the examination there. Single checklist for each student there. All the students have to go through the same procedure, same timing. So again, that biases is removed there. Use as summative as well as formative. We can conduct it at the end or during the procedure. We can see the, for example, at the end we will see what this student or the examinee has done, and sometimes we can do it as the formative as well. That means we will see the whole process, how the student is doing it, what sort of steps he is taking. So we will not see the conclusion only, we will see the whole process, and we will score on the basis of whole process, not only on the basis of conclusion here. So moving to again to the advantages.
They are supposed to perform the activity. Are they supposed to write anything on the pen paper?
Yes, ma'am. It depends.
They have to
Yes,
visualize that also.
Yes, ma'am. It
You know, if we have a time constraint, if we give the procedure to the patient, then sometimes we have staff deficiency. We allot only one examiner. Then she will give 10 activity to the 10 students. In that case, they will write that or whatever. We have kept some, like right on the list, procedure steps of CPR. They will write that. After that, when we correct that, then only we will follow the checklist and we can give them marks. Is it visible in this?
Ma'am, actually what we do is that we, as already mentioned, the time is between 3 minutes to 10 minutes.
10.
So that means if we are going for that sort of a procedure, for example, we are telling them to calculate the drug dosage for any patient. So at that time, it will be just the formulas there. It will hardly take them 2 minutes if they have studied it. Yes, ma'am. Yes, ma'am. For example, paper-based questions will be only those questions which will hardly take. For example, what is the ventilation compression rate in the neonatal situation? Only this question. So at that time, they would have to write that theoretical paper.
We are supposed to observe them also.
हाँ मैम, और इसमें क्या है कि अगर हमें पेपर बेस्ड रखना है तो हमें हार्डली वो क्वेश्चंस रखने जिनमें 1 मिनट मैक्सिमम उनको लिखने में लगेगी. फॉर एग्जांपल ड्रग डोज कैलकुलेशन वी कैन डू देम फॉर एग्जांपल सीपीआर और एनी प्रोसीजर. For example, we can give them numerical related problems, or we can give them those questions that will not take them lengthy of time. Yes, these OSCE and the OSPE, the main purpose of the OSCE and the OSPE is to assess the psychomotor, as I already told the psychomotor. So we are going to assess how they will do the procedure. So as I already shown you here that this here, for example, here is the newborn resuscitation. So we have to tell him to perform the neonatal resuscitation, and the checklist will be there. Do we have the checklist here? मैम आपको देखेंगे तो वहाँ पे पूरा mention करके है, has the student did this, not done, and partially done. And on the basis of that student criteria, done, partially done, or not done, and you will get marks. So that means theoretically लिखना मैम इसमें उतना ज़्यादा मैम नहीं रखा जाता है. So उसके बाद फिर मैम
Disadvantage.
Yes, now moving ahead to the disadvantages of the OSCE and the OSPE there. Knowledge skills are tested in the compartments of holistic patient here is not possible. So that means, what does this point mean here? That we are assessing them in a particular area. For example, newborn situations. For example, cartograph. We will not holistical care. We cannot see there how they will. For example, we will give the question to the patient that neonatal resuscitation you have to do. So that means all of his mind will be on the neonatal resuscitation. He will forget there how to maintain the rapport with the patient. He will forget there how to maintain that interpersonal relationship with the patient. So holistic care we cannot assess there. The OSCE may be demanding for both examiners and the patients. Yes, ma'am. More time in the setting up, shortage of the examiners there may be quite distressing for some students. Because recently I went through an OSCE exam and it was very distressing. It was a limited amount of time. We had to do a lot of procedures. Yes, ma'am. So hardly 2 minutes में कभी-कभी बहुत कुछ करना पड़ता है वहाँ पे. So उसके बाद
मिस भी हो जाता है.
Yes, ma'am. Sometimes it requires very careful and meticulous organization by the examiner or by the authorities there. Now, talking about the feedback that has been received from the students there, assesses our performance in action, detects our weaknesses. As told by the students there, these are positive points that they have mentioned, that it detects our weaknesses, assesses our abilities in solving clinical problems, assesses our clinical skills and communication. These are the positive points that the students have mentioned related to the OSCE. Again, the positive feedback by the students that they have given related to the OSCE. Student is made to organize his thoughts there, increase self-confidence, fair to all the students, clinically oriented. It is training the students because OSCE is also an international examination.
Yes.
So after that, the negative feedback that has been received by the students related to the OSCE and the OSPE might be exhausting for the real patients. It is humiliating to some patients because they think that we are becoming sort of a test here, and needs extra preparation time, burdens on the student. Some stations require more time than the other. After that, now the last point that I will mention here. After that, Mr. Mudasir sir will come here, and now how we can overcome the difficulties in the OSCE. We have to train the course for the teachers related to OSCE and the OSPE.
That is right.
Yes, ma'am.
This is actual aim of your principal.
Yes, ma'am.
That training course for teachers
Yes, ma'am.
in this domain is very important.
Yes, ma'am.
Our students should be familiar with this. They will not get any difficulties. Okay.
After that, preparation of the student from the beginning of the course. It's not like we will tell them now you have to do the OSCE, so we have to prepare them from the beginning. Proper communication with the administrators should be there. Ensure reliability and validity of the evaluation. adequate planning and organization should be there, preparation of the OSPE bank should be there, this is the checklist that we do, and it can be conducted along with the PPE. Now I request Mr. Mudasir sir to please come on the dais and take over.
आपके पास टाइम है बताएं।
Honourable President, dear leaders, अस्सलाम वालेकुम warahmatullahi wabarakatuh। नीरज सर और रिमशा मैम ने यहाँ पे आई थिंक सारा कंक्लूड कर लिया है। मैं खाली एक स्लाइड या 2 स्लाइड्स पे जाऊँगा, बाकी जितने भी लिमिटेशंस हैं या स्ट्रक्चर्स हैं हमारे OSCE एंड OSPE के वो सारे इन्होंने किए हुए। मैं थोड़ा सा यहाँ पे करूँगा कि जो अपोलो कॉलेज ऑफ नर्सिंग है चेन्नई में, उन्होंने एक स्टडी कंडक्ट की हुई है टुवर्ड्स द प्रैक्टिकल एग्जामिनेशंस की जो सर्टिफिकेशन है इन द स्टूडेंट्स, और उसकी जो फाइंडिंग्स है इस स्टडी ने रिवील किया कि जो 67% ऑफ स्टूडेंट्स हैं उनका नेगेटिव एटीट्यूड है, क्योंकि जो प्रैक्टिकल एग्जामिनेशंस हैं और उनकी वजह से क्या होता है, फटीग ज़्यादा होता है, स्ट्रेस में बच्चे ज़्यादा आ जाते हैं और वो कुछ बोल नहीं पाते। एज वेल एज ये भी वहाँ पे रिवील किया गया है कि जो बच्चे हैं वो चाहते हैं कि 67% स्टूडेंट्स ऐसे थे जो चाहते थे कि OSCE एंड OSPE जो है वो इंक्लूड हो हमारे प्रैक्टिकल एग्जामिनेशंस में, क्योंकि यहाँ पे साइकोमोटर एक्टिविटीज एज वेल एज कॉग्निटिव एक्टिविटी जो है वो एबिलिटी भी हम चेक कर सकते हैं। जो बाकी इन्होंने किया है, मैं 2 चीज़ों पे यहाँ पे रोशनी डालना चाहता हूँ। एक चीज़ कि जो हमारे बच्चे होते हैं ड्यूरिंग जब वो मूव करते हैं फ्रॉम स्टेशन टू स्टेशन, उनमें फटीग बहुत ज़्यादा आता है, स्ट्रेस बहुत ज़्यादा आता है और जो इसकी स्कोरिंग है वो कम हो जाती है, और जो प्रोफेशनल जजमेंट है वो यहाँ पे लैक हो जाती है, क्योंकि जो एक इवैल्यूएटर होता है उसकी नजर होती है चेकलिस्ट पे। समटाइम्स एक स्टूडेंट कोई भी पर्टिकुलर टास्क किसी हाई स्टैंडर्ड से कर लेता है, लेकिन चेकलिस्ट में वो चीज़ इंक्लूड नहीं होती, तो वहाँ पे क्या हो जाता है, तो वो प्रॉपर स्कोरिंग नहीं मिलती है। और एक चीज़, समटाइम जो हमारे इवैल्यूएटर्स होते हैं उनमें फटीग आ जाता है और बोर्ड में आ जाता है, तो उसकी वजह से क्या होता है कि जो हमारी स्कोरिंग होती है बहुत भी लैक हो जाती है। एंड जो और एक चीज़ मैं यहाँ पे कहना चाहूँगा कि जो हमारे OSCE एंड OSPE है, इससे जो टेस्ट एंड रिटेस्ट रिलायबिलिटी है वो एक्सीलेंट है इसमें, एंड इट इज ऑल अबाउट द OSCE एंड OSPE, एंड आई वुड लाइक टू इनवाइट द प्रिंसिपल मैम टू कम ऑन दिस डे एंड शेयर हर वैल्यूएबल इनसाइट्स अबाउट।
Dear faculty, Assalamu alaikum. I'm so happy that my teachers are putting efforts of doing so many things for the development of our future, for the development of our nursing profession. Main aim of my main module is that whatever is already there, we are having more or less knowledge regarding that, and we are already used to do all those things. But the new things, like we have already done faculty development program on forensic nursing, arrhythmias, and so many. Yeah. So this one, OSCE and OSPE, it is rather started in 1972. But reached in nursing, at that too in Kashmir, just when we started the semester-wise syllabus. We practice that. Our students are unaware about this program, OSCE, OSPE. Mainly, a person is having 3 traits. What we used to say, knowledge component, attitude component, and skill component. In other words, cognitive, affective, and psychomotor. All the 3 components are to be utilized when we are undergoing the OSCE or OSPE. As a teacher, first we have to prepare the student for the same so that we can evaluate best. We have students, now they are going to appear in practical examinations. Practical examiner demand is that I am going to conduct the OSCE. Our students are not aware for that. So how to overcome that? It is pre-planned. Our student must be trained for that so that they will not get confused. They will be competent enough to reply. They will be well informed of doing that particular procedure. so that they will not get failed in that examination. My aim is that. Can you show me that slide? In that you have OSCE, OSPE, OSCE and OSCE.
Abbreviations. Slide.
Four
Yes,
components.
Ma'am, it is actually OSCE, OSPE,
Computer and
video
OSPE
video
and
editing
OSPE.
and computer history.
That I am not explaining. उसमें मुझे थोड़ा इंटरेस्ट पड़ गया. I hope my teachers will just come forward with the things which we are lacking. See, first aid, everybody is well versed with that. See, we are with the advanced basic life support people, they came, they showed us. But each and every person in our college, like our Tawseef, Mahboob, are you listening to me?
Yes, ma'am.
That's Tawseef, Mahboob, Ishra, Zahir, Farooq, Adil, Kamran, driver, they all should be what? Very severe. अगर आप लोग ऐसा कर लेते मैं appreciate करती. Next thing should be that we will train them to deal with these situations. If you go to airport, you will see those trolley lifters, they also know the CPR. If you go to railway stations, the coolie also knows. We are in college, let us spread this knowledge and let us make the public trained in saving the life. How can we save the life? OSCE, video examination. Abhi, just today only I was telling to my teachers that tell your other colleagues that in first semester, BSc first semester, give them assignments. They will learn that will be video assisted. Video assisted learning and computer assisted learning is need of the day because this instrument is always in our hand. There is no lab, there is no classroom, there is no teacher, but they are having these two components. They can do the wonders by using this. That's why I told her that to inform them, they will do the assignments after video assisted learning and computer assisted learning. So this, my objective will be fulfilled by utilizing this method also.
Yes.
So OSCE and OSPE is not that we are doing it in examination purpose only. No, OSCE and OSPE we do to teach them also. You know?
Yes, ma'am.
When we start showing them, for example, assessing BP. So there are steps for that. In nursing foundation lab or skill lab, is a skill lab called. So in that, then only we can make the station as we have made today. We will keep it as it is. If we shift the lab in the library, there also we will make the stations so that our students be well aware about the OSCE and OSCE and inform them in the classroom that there are new methods of practical examination in which you are going to face OSCE and OSPE. OSPE is in the classroom, OSCE is there where you will be given one situation regarding your, like maybe it will be activity related to a nursing procedure, medical surgical, psychiatry, gynae, whatever. You have to perform that within given period of time. What happens actually when we get a question paper, we give justice to only 2 or 3 questions. One we are leaving.
Yes.
What happens there? We are leaving our marks. So teach them, attempt each activity because each activity is having some marks. So this is my aim in doing this activity. Congratulations, Rimsha, Neeraj and Mudasir. You have now you can do this thing. You can put it full, whatever we have done on maybe what are the print media on that so that others can take benefit of it.
मैम वो another part
मैम अभी demonstration में नीचे
वो देख करेंगे मैम
अब कहाँ?
तो
आपका
मैम उनको कम है, हम उनको मैम आपके लिए रखा है,
मैं
तो
उसको
आप देख लीजिए उसमें मैं 10 मिनट शॉर्ट लेट हुई थी।
चलो फिर देखेंगे
ठीक है,
वो।
बस ठीक है।
इसका हो गया।
These are our students who are going to participate in the OSCE. Ma'am, and these are the stations as already marked. And after the buzzer, they will go to the concerned
Start
stations.
one activity. I want to
Yes,
see
ma'am,
that.
sure. Students, you have got the instructions for the OSCE examination. Yes, sir. So now after the buzzer, you will take your concerned stations. And there is a procedure for you. Then after that, as already the instructions are provided to you, you will move to the second station. So the buzzer starts now.
You are doing, take for it. Learn from
घर में किसी की मदद नहीं करें, यहाँ पे साइड में होने से कोई साइड
वो जो सॉलिड टिश्यू है वो हमें थोड़ा
जो इसका इम्यूनिटेशन है वो हमें पता है उसका जो इम्यूनिटेशन है हाई पावर है। सो एक्सक्लूसिव डिसिप्लिन में क्या होता है, आप जो मदद होती है
and seminar, both. First of all, we just give orientation to our students and teachers in the classroom. We have explained about what is OSCE, what are its advantages, what are the disadvantages, and how to do it, how to conduct it, how to plan it, what are the articles, what are the things we require for it. Then we make it sure that each student perform one activity within a given period of time, and you successfully have covered the time and you have done your activity well. And actually this method of teaching was started in 1972, and usually it was doing in the labs in medical colleges. We were giving equipments and slides to the students. We were saying them identify and list down, and explain the instrument and write down its uses. Now in nursing, we give one activity, for example, catheterization. We give patient to the dummy or patient, a well-trained student nurse, and we make a checklist for that. All the activities are written in the checklist so that every student will get proper time to perform that activity. After performing that activity, we are assessing and we are allotting the marks. This way we will not make any bias, and we will give right marks to the right student, and it also helps us to rectify the problems faced by students, and whatever lacking we are observing that student is not doing it well, we repeatedly make them to learn, and then finally we get the feedback and we allot the marks. So OSCE is not only examination, it is structured examination, but if we see at the view of a teacher, we give them every focus, every aspect of activity to do it step by step. Thank you so much, my teachers, my students, and I hope wherever you will go, wherever you will be examiners, wherever you will go as student, and you will do it very efficiently. Really, skillfully, very competently. Thank you so much.